The Kinda Magic project in Cornwall is based on a very simple formula.
Hello, I've come to ask you some questions. We're getting feedback.
That the best way of finding out what patients think is to have an honest conversation and to use that conversation to make improvements quickly.
The principles of the process are what's really important, and that is collecting the feedback face-to-face or in person, using it as part of a conversation with a patient so that we can explore and probe more deeply with the responses they give to the questions, and we can ask them, why is that? All of this we feed back to the wards as soon as we've finished, so we do verbal feedback and then follow that up with a written qualitative report a few days later.
The NHS Patient Feedback Challenge has enabled the project to develop this into a formidable programme. The key to its success is the questions, which constitute the Kinda Magic toolkit. But the questions are not prescriptive and can, indeed must, be changed to accommodate the patient being spoken to. This flexibility has enabled the project to spread far more widely than expected.
Spread has come from areas that we didn't expect it to at the beginning. We had a lot of interest from some other organisations, not that similar to ourselves, partnership trusts and acute services. And through the project, spread has occurred in a fairly spontaneous fashion in some instances. We didn't plan to have spread into children's services, but children's services saw it and recognised this as something that they could take and adapt for themselves. We didn't expect spread into mental health services, but that's taken hold.
This is a question that we were struggling with.
One of the target groups is people with learning disabilities. People like Anthony, who today is helping to adapt the toolkit so that the questions are simpler and more comprehensible to people and patients like himself.
What about this word respect?
People can struggle with the wording. The picture of people with pictures is easy to read.
Anthony's employed by the PCT to support health professionals in supporting people with learning disabilities. So when we wanted to develop an easy read version of our patient survey, we took the questions to the champs. There were 6 of them in the room, and we looked at the wording. One of the words is compassionate. Do you feel the staff are compassionate? And the champs felt that wasn't a very good word, or they didn't really understand it, and they felt the word kind was better. So they helped put our patient survey into an easier understanding format. They also wanted to have some pictures, because a lot of people with learning disabilities don't read. So we have pictures with the easy read words as well. And then we have an up and down sign as well, yes and no.
This is a very exciting project. What we've done with the principals is started to learn on how we can get real feedback from patients and make a difference to clinical teams at that point. What we're doing next with the project is, as we've shared our ideas and experiences with our patient experience group, and we're now moving forward to adopt this trust-wide.
Right, so we've got a set of tools that can be used for people.
Another exciting development is the way the scheme is being developed to help patients with cognitive impairments, including dementia. Sue Greenwood is doing pioneering work with the elderly.
Ethically and morally, you know, it is right that we interact with these groups of people and we do not exclude them. They need to feel valued. We need to understand what their experience is, whether we gather that as a verbal feedback or whether we look at how we can gather that in observations. It's very powerful feedback, and it will help us to change practice out there. So, you know, it's really important.
In hospitals where the process originated, it has become standard practice.
Denise, here to do the patient metrics again. Just come round again.
It starts with an inquiry about the ward and the identification of patients who may not be suitable for interview because they are too poorly. A conversation with the patient follows. This is based on the questions in the appropriate toolkit. After that, there's a quick discussion with the nurse in charge to report matters of immediate concern. Then, a written report is produced to outline the feedback. And finally, a monthly meeting is held to establish how and where improvements can be made.
When we actually have our results, they're RAG rated, red, amber, green, And that's not always very popular because the red results always causes some concern, and they're the things that we have to stand up and talk about, particularly to the board, and certainly at my level that's what I would take back. I think the important thing is to consider that when you've had a red, that's the thing that you really need to act on. The green things are fine, so actually the red things are really important to us, and the red things are the things that we share as a group. So as an organisation, you know, example, if I was the matron that had some reds, I would take that back to the Joint Sisters Forum, the local matrons forum, because quite often we're not the only ones experiencing that.
When the project was introduced, there was resistance from clinical teams, but that is now a thing of the past.
When we first started this process, the staff felt this was another audit. It was just another collection of data. We couldn't see the process and we couldn't see what became of the data collected. It didn't mean anything. It didn't involve us. But now it's a totally different picture. We actually own this audit. We'll be able to take control of it and do something about the results that we're getting, and we're doing something about it now rather than that data going off somewhere and we never see it again.
I think the key thing in that was giving them the qualitative feedback along with the metrics data, because that enabled them to understand what their metrics were telling them, because the metrics, after all, are only an indicator. They're not the story. The story is in what patients say.
Another innovative aspect of the Cornwall project has been to employ non-clinical staff to interview patients.
The journey for me has been immensely powerful, much more than I expected. In my day-to-day health and safety job, that's what I do a lot. I go around with a clipboard, I ask questions. It's not so meaningful. Having done the patient experience questionnaires now for a long period of time, I've started to see the value and worth of what this experience is all about for the patients. For me, it's about the care and quality we give to our patients, which I feel is marvellous. Mainly because I'm seeing huge improvements. Culturally, I'm seeing huge improvements. I'm seeing fantastic care delivered to our patients, not all of the time, but in the main most of the time. And for me, that has been absolutely amazing.
In Cornwall, they decided not to use volunteers, but their spread partner in Hertfordshire is using volunteers with great success.
Hi, my name's Sue. I'm a volunteer for the trust.
Sue is a psychology student and volunteer for the Hertfordshire Partnership NHS Foundation Trust. Today, she's getting feedback from service user Justine.
I found the experience interesting and rewarding. In terms of my study, it's easy to read in a book about how conditions are and how people's lives are affected, but to actually find out for real what it's like to live with that condition or have that experience, this has really added, and this has really given me that opportunity to meet service users that are living the things that I've read about in the books.
I think feedback from service users and carers is a really important part of improving services and making changes that are needed, and it gives people the opportunity to express how they feel about different areas of the service that they've come into contact with. So yes, I do think it's important.
The initiative has been led by Lara Harwood.
We have surveys called Having Your Say, which we've been using in the trust for about 10 years. But because we're a mental health trust, we felt that using staff to speak to service users about their care wasn't always appropriate. People might feel that they don't want to say how they feel about experiences and be honest about their time with us. So we felt that we could use Peninsula's ideas, but we felt that perhaps it would be an idea for us to use volunteers instead of staff. We have mandatory training for staff within the trust, and our volunteers link in on safeguarding training relating to people, which is some training where they can get some tips on how to speak to service users in particular situations, and there's role plays with actors, so that's a really useful one. We also do complaints training and fire training and health and safety as well, so they have to link into those before they start.
Already, the Kinda Magic process is embedded within normal hospital practice in Cornwall, and actual improvements are being made as a matter of course.
Sustainability as regard to how the clinical teams continue responding to the feedback they're given is, I feel that they're so keen on receiving their feedback that whilst they're getting it, they will keep responding to it. They've really taken ownership of it. They look for their results every month. If they feel that if data is late, they've been on the phone asking where it is.
The spread of the scheme has surprised the organisers, especially since it has extended beyond the NHS. Here at the Tremethick Care Home, they have adapted the tool for their residents, many of whom suffer from dementia.
Because we've used or had a variation of the tool within our home, we're able to learn more about the individuals and gain better relationships, and therefore provide activities, meaningful moments that are much more suitable to the residents, and hopefully would improve their quality of life with us.
I think this works because what we're doing feels very real. We're talking to patients. When you talk to patients, you're listening to what they say. You want to do something about it when they're telling you something that isn't quite right. It's also very gratifying for the clinical teams when they hear good feedback, because actually most of it is good feedback. So the success has been, I think, the motivation that the staff feel, the fact that they really want to know what the real feedback is, and that they're very happy to take the negative feedback along with the positive feedback, because they want to take action.